Well, living with any facial difference can be tricky. At a fundamental level, it's not uncomfortable or painful, so we always advise parents when their child's born that this isn't something that hurts them. It just feels like they're normal facial features. But from a social developmental standpoint, there can be a lot of tricky things that children experience. One of the key features of our interdisciplinary team is incorporating social work and psychologists who help children accommodate and understand the differences, but they also help parents understand how to support children through these early developmental milestones. At the end of the road, hemifacial microsomia can be treated surgically in a way that nicely restores facial volume, but many of those treatments don't happen till later in life, and so the childhood experience of having some of those persistent facial differences really can be challenging. So my goal for them throughout childhood is to make sure that they and their family feel really well supported and know that these procedures are going to be available to them when they reach the right developmental age points to undergo them. And my hope for them is that at the end of their facial growth and development, we can restore facial symmetry to the point where other people don't even know that they were born with facial asymmetry.
When a child with hemifacial microsomia is fully grown, it's common that the teeth will not fit together perfectly because of the asymmetric growth of the jaws. At Boston Children's Hospital, we like to coordinate treatment between our surgical teams and our orthodontic teams so that at the time of jaw surgery, we can achieve facial symmetry, function, and a good bite. This typically requires a period of braces treatment, both before and after the surgical phase of treatment. In the end, we can usually achieve all of our goals with regard to aesthetics and function.
Children with hemifacial microsomia can really do anything. They can have a normal childhood. They can go to school like other children. They can participate in sports and extracurricular activities.
Most children with hemifacial microsomia will go on to speak, breathe, eat, and otherwise function completely normally. Our team will work with your child and family to determine when the time is right for procedures that can help improve symmetry and function further. Our team can help you and your family have a very typical childhood. We have the resources and the expertise to help walk through the process of correction for all of the components of hemifacial microsomia at the appropriate times. Beyond the procedural needs for this diagnosis, we have many ways to support you and your family through this experience.